Let's continue with this. On Monday, President Cyril Ramaphosa said the tourism numbers are picking up. About 5.7 million visitors arrived in the country last year, which is an increase from the previous year. But could the cholera outbreak put a damper on this? Let's speak to Tshepo Matseba, Reputation First Managing Director. Tshepo, thank you so much for your time this afternoon. Before we even get into the communication around this, is cholera a huge concern for visitors?
Good evening, Bongiwe, and to the viewers. Thank you for inviting us. Yes, cholera is a huge risk in terms of perceptions of South Africa that tourists may hold, given the fact that when they come to a country, you want to go to a country that is safe, a country that is in touch with its healthcare facilities, but a country that is in touch with the sensitive issues that are facing communities daily. Now, the minute you start doing a death count from 0 to 17, it becomes one too many. And that is where, irrespective of the caliber of a traveler, the perception of an inability to handle a crisis quickly and to anticipate it quickly becomes an impediment to tourism, and it really creates an impression that we are not in control of the provision of basic services such as water and, importantly, clean water.
Now, let's talk about then another issue as you talk about them being in control. Fingers are pointing here to various parties as we keep listening to officials talk about what is unfolding here. There's also different versions. You listen to the city, which says that the water is safe, there's nothing wrong, but you watch what's happening in council, the mayor not willing to drink the water. And then you listen to what the Deputy Minister of Water and Sanitation has had to say. It's still too soon to say that the water is safe. Preliminary results are not final. This communication or miscommunication alone suggests that they're not in control.
No, absolutely not in control. I'm from Hammanskraal, and I know that for more than almost 2 decades, nearly 2 decades, there's been a water crisis in that area. My family there and my grandmother rely on still water, so she has to buy water. She's a pensioner, she's unemployed, but she has to buy water to survive. And she's just one of the many, many hundreds of people in that area who actually rely on paid water and Jojo tanks provisioned by the municipality, which arrives probably once in a while, and this is not consistent. And even at that level, you can't reliably say that this is safe and drinkable water. If you observe the contents of that water, the color, the patterns that you see, the movement of items in water that comes out of a tap, and you pay actually municipal services for that water, it's not even safe, I would imagine, to wash with, if you look at the tap water that comes out of the entire Hammanskraal area. And so the fact that government in its different spheres, local government, provincial government, and national government, they are all speaking completely different languages. And this is also compounded by the fact that there's politicking between the different political parties that have led the city of Tshwane over a period of time. It creates really a serious disaster because communities do not know who to listen to and who to trust. It even places a significant burden on the Department of Health and health officials because they can actually try their best to communicate as experts in the healthcare fraternity. But when government doesn't have a single position and a common understanding, both local, provincial and national, about what actually is going on in that area, but also about the other parts in the Free State, there's a bit of outbreak, about what actually is happening, a single fact sheet that gives people a common understanding of what is happening, and that government has a single plan, or that is at least working toward a single plan. And when you have that, you create space for a lot of uncertainty. And we know what has happened. We have so many lessons in South Africa, from HIV, AIDS, to COVID-19, of best practice about how to communicate when we deal with diseases and uncertainty. But at this point in time, politicians are taking over instead of thinking and being practical and thinking about the people, as they say, on the ground.
So as a resident of Hammanskraal, I'm going to put it like that right now, who do you trust?
Right now, the only people that I would say you could trust are the healthcare professionals who are providing the service. But the politicians have for many, many years made different promises. And at this point in time, they are even making conflicting statements. So one cannot trust anyone except to trust in the healthcare system, because the healthcare system in South Africa is capable of responding to different levels of crisis in health. But when you listen to the solutions from politicians and the statements and the contradictions and the fact that a lot of money is being wasted on corruption, a lot of money is being wasted sourcing irrelevant material, like more than 93 million that we heard the other day that was spent on cabinet ministers and their homes. That sends you a chilling signal that we can't even fix a 2.5 billion worth of a problem when we've spent so much money. I mean, there was a couple of hundreds of billions, isn't it, that were invested in the COVID-19 pandemic, our response to that pandemic. We don't know where that money is. We can't account for it. But we are failing to provide basic services such as drinkable water. I mean, drinkable water tells you that we have become a country and a government that doesn't care. A country and a government and politicians that are actually insensitive to the reality, that are actually insulting people with politicking instead of providing the very basic services that they promise when they go towards elections every single 4 to 5 years.
And one wonders right now, someone sitting in Hammanskraal, what's going through their minds, particularly when they see all of this unfolding. And as you say, it's not difficult to compile a single fact sheet just to say this is what's going on, this is where things are, this is how we are responding to it. And everybody speaks from, with one voice. But let me thank you for your time, Tshepo. We do appreciate it. That is Tshepo Matseba, Reputation First Managing Director, and talking about the importance of not speaking past each other. There's so many conflicting messages on this particular crisis, and one wonders who is telling the truth.